Mr. Speaker, honorable members, I thank you, Honorable Speaker, for giving me this opportunity to appear before this House and to provide a report on Kenya's preparedness and containment and management of the threat posed by Ebola virus disease, following your directive during the plenary sitting of the 2nd June 2026. I also acknowledge the concern raised by honorable members regarding the possibility of Ebola virus disease importation into the country, the establishment of a quarantine and isolation centers in Kenya, the preparedness of public health facilities, and the nature of the regional and international coordination mechanism. From the onset, I wish to assure this House and the people of Kenya that the country has not recorded any confirmed case of Ebola virus disease as of 3rd of June 2026. The government is, however, treating the regional outbreak with the seriousness it deserves, because Ebola is a severe disease with high fatality and huge public health threat. And Kenya's position as a regional aviation, trade, transport, and diplomatic hub places the country at increased risk of importation of the disease. Honorable Speaker, the epicenter of this outbreak is in DRC and Congo. As per our last situational update, the Democratic Republic of Congo has reported 1,083 suspected cases and 259 deaths. Of these, 321 cases are laboratory confirmed, with 48 confirmed deaths. A total of 2,746 contacts have been listed for follow-up. Uganda has reported 12 confirmed cases and 2 deaths, with 642 contacts listed for follow-up. Honorable Speaker, this disease is associated with the Bundi species of Ebola virus. This is significant because there is currently no approved vaccine for this particular virus or for this particular species. The outbreak has also affected healthcare workers both in DRC and in Congo. In view of the regional risk, the WHO declared the outbreak as a public health emergency of international concern on the 16th of May 2026, while Africa CDC declared it a public health emergency of continental security. These both declarations by WHO and Africa CDC signals an extraordinary public health event that poses a risk to other countries and requires a coordinated international response. Kenya has therefore activated the National Preparedness System in accordance with our constitutional duty to protect the right to health, our obligations under the Health Act 2017 and the International Health Regulations 2025. Honorable Speaker, before I respond to the many questions that you have asked me to answer, let me just give the country what is Ebola and which type of Ebola is this. Ebola is a severe, often very fatal illness in humans. There are 3 different types of species. There's Ebola, Zaire, Sudan virus, and the current one we have, which is called Bundibugyo virus, which has the capacity to cause large outbreaks. The modes of transmission are many, Honorable Speaker and members. The infection index from contact to the wild animals. Thereafter, transmission occurs from person to person through blood or bodily fluids from infected persons or dead bodies. Transmission can also occur from contaminated surfaces or objects like bed linen and clothing or unsafe injection practices. What are the early signs and symptoms? The average incubation period of this particular virus, Ebola virus, is between 2 to 21 days infected people are not contagious until they develop the symptoms. Initial signs and symptoms are non-specific. Many common infections, like other diseases like malaria, typhoid, meningitis. But the symptoms are usually of a sudden onset. They include fever, chills, headache, joint pain, muscle pain, backache, nausea, vomiting, diarrhea, fatigue, weakness, skin rashes, among others. Bleeding is less frequent and can occur in the later stages of this disease. Who is at risk of infection? Travelers to the affected countries like DRC and Uganda, contacts of travelers from the affected region, family members of the Ebola virus diseases, healthcare workers taking care of the patients with Ebola, or people handling bodies of Ebola victims. How do we prevent Ebola? Early identification and prompt referral and isolation of the suspected cases. Basic universal precautions of hand hygiene and gloving in health setups during the routine work. Wearing of the full personal protective equipment when handling cases or suspected or confirmed Ebola. And finally, to avoid contact with the bodily fluids of suspected cases. Honorable Speaker, allow me now to address the questions that appeared on the letter you addressed, and the first one was the measures by the government to manage and contain the threat of Ebola. Honorable Speaker and members, the government has activated a whole government preparedness and response framework led by the Ministry of Health through the Kenya National Public Health Institute. The National Ebola Incident Management System was activated on the 20th of May 2026 in order to provide a unified central command, coordination, and decision-making. This structure is supported both at the national and county public health emergency operation centers, which remain on high alert mode. 2, under this arrangement, we have also strengthened our surveillance of health facilities within our communities and the points of entry. We have issued advisories to all the 47 counties covering Ebola case definitions, infections prevention, control reporting protocols, guidance on isolation, sample referral, contact tracing, among others. Our rapid response teams, Honorable Speaker, have been placed on standby for deployment where alerts are reported. Government has also enhanced screening at our 26 official points of entry, including our international airports, land border crossings. As of yesterday, 2nd June 2026, 71,243 travelers have been screened cumulatively, including the 2,506 travelers who were screened in the last 24 hours. Screening focuses particularly on travelers from the affected countries and high-risk travel routes. To date, Honorable Speaker, the national surveillance system has captured and investigated 22 suspected alerts from across the country. All of them have tested negative. These alerts were reported from Nairobi, Kiambu, Uasin Gishu, Nyeri, Nakuru, Nyamira, West Pokot, Kisumu, and Bungoma. In the last 24 hours, 3 alerts from Nairobi, Uasin Gishu, and Bungoma were investigated and they were confirmed negative. Honorable Speaker, the Ministry has also operationalized the public communication mechanism, including the national number, toll number 719, which is our public health hotline, to facilitate communities to report, to do public inquiry, and to give health advisory. Public messaging is being disseminated through the national and the county channels in order to educate the public on the risk factors. Honorable Speaker, the second area you told me to address through the letter from Parliament was the preparedness of the public health facilities, the isolation units, the medical facilities, and trained personnel. Honorable Speaker, the House specifically requested a report on the level of preparedness of public health facilities, including isolation units, medical facilities, and trained personnel. And I want to confirm that the Ministry of Health has undertaken facility readiness assessment and continue to strengthen capacity at the national referral facilities and in counties considered at high risk. At the national level, Kenyatta National Hospital has prepared an 8-bed isolation and treatment unit and completed a dry run of how the index case will be handled. The facility has a separate waste management system to support the safe handling of infectious waste. The National Police Service Hospital has been assessed and has 49 beds ready for activation as part of the surge isolation capacity. At the county level, 29 counties have identified designated isolation and treatment sites. The Ministry of Health, the Kenya National Public Health Institute, and relevant regulatory agencies are undertaking on-site verification, quality assurance, spot checks to confirm that these facilities meet the required standard for infection prevention, control, patient flow, waste management, staff protection, and emergency referral. Honorable Speaker and members, these facilities are part of Kenya's national public health preparation architecture. They are not established for exclusive benefit of foreign nationals, foreign governments, or any special category of persons. They are intended to protect all persons within the territory of Kenya, including Kenyan citizens, residents, refugees, visitors visiting our country, diplomats, expatriates, and any other person who may require isolation, testing, or treatment based on the medical need and public health risk. This position is consistent with the Constitution, the Health Act of 2017, the Public Health Act, and the International Health Regulation 2005. If any person is identified within Kenya as a suspected or confirmed Ebola case, the correct public health response is to safely isolate, test, treat, and trace contacts within the jurisdiction where the risk is detected. On personnel readiness, Kenya has mapped a surge capacity of 241 expert responders comprising of 51 epidemiology and laboratory training program, 118 African volunteer health corps professionals, 72 basic health emergency management specialists, and these teams are on standby for deployment to support surveillance, contact tracing, case investigation, laboratory diagnosis, and field responses. Additionally, 1,069 national and county health workers have been sensitized on Ebola preparedness and respond through a very structured virtual sessions. On-site training and simulation drills have been undertaken in Busia County and Busia border, where 60 health workers have been trained, and additional exercises are going on. Our plan for the county of Turkana and Trans Nzoia. A national tabletop exercise is scheduled for 15th to 18th June 2026 to test coordination, referral, laboratory, and response. Thirdly, Honorable Speaker, you have asked the measures we have activated as a ministry, which I have really enumerated. Honorable Speaker, in surveillance, the health facility and community-based surveillance have been intensified, Ebola case definitions have been distributed to all counties. Rapid response teams remain on 24-hour standby. Counties have also been directed to identify and operationalize isolation facilities, holding areas, and quarantine facilities. At our points of entry, screening has been strengthened through health declaration requirements, temperature screening, symptoms assessment, and referral protocol. Thermal scanners, holding rooms, ambulance systems are being reviewed and activated in all our priority ports of entry, including major airports and high-volume land border points. On our laboratory preparedness, the virus being an extreme biohazard, 4 laboratories have been designated for Ebola testing. The National Public Health Laboratory, KEMRI Nairobi, and KEMRI Kisumu, and a mobile laboratory deployed to Busia. These laboratories are equipped for molecular diagnosis with a mobile laboratory positioned to reduce the turnaround time in the border region. However, Honorable Speaker, I wish to be very candid with this House. While laboratory capacity is strong, the current stocks of specialized test kits, reagents, personnel protective equipment, which are estimated to support only approximately the first 200 suspects, are in place now. And this is why additional emergency financing and partner support are required to build a more adequate testing capacity. In infection prevention and control, the World Health Organization has provided 1,000 Ebola PPE kits, which are available and being prepositioned to support preparedness activity. Initial preposition is focused on strategic sites, including Kenyatta National Hospital, Kenyatta University Teaching, Referral and Research Hospital, Mombasa, MTRH in Eldoret, Turkana, and other high-risk points of entry. Honorable Speaker, the 4th item was on regional cooperation, coordination with our neighbors, foreign governments, and international health agencies. Honorable Speaker, the House requested a report on that. Kenya is working closely with all the affected and neighboring countries, regional institutions, international partners, because Ebola is not a national problem. It's a regional, it's a global security, it's a global public health security threat. The ministry is engaging in cross-border coordination with our sister country, Uganda, with a particular focus on sharing surveillance, information, traveler screening, case notification, contact tracing, laboratory referral, and rapid response readiness. Kenya is coordinating, and we have held meetings at the highest level with the World Health Organization, with the Africa CDC, with the IGAD, with the EACC, with the International Organization for Migration, with the U.S. Center for Disease Control, all these at ministerial level, and with other development partners. This cooperation is focused on surveillance, on laboratory support, on simulation exercise, on technical guidance, training, risk communication, logistics, and partner resource mobilization. And I wish to emphasize, Honorable Speaker, that international cooperation does not mean surrender of our national authority and sovereignty. All public health decisions within Kenya remain under the authority of the government of Kenya. International partners provide technical assistance, commodities, financing, training, and logistical support. Regarding the recent media reports alleging that Kenya has entered into an agreement with the United States of Government to establish a quarantine facility for U.S. citizens or foreign nationals, I wish to state it clearly that Kenya and the U.S. government signed an agreement on cooperation in threat reduction, biological and infectious diseases engagement program on the 24th July 2015 during the state visit of our President and President Barack Obama. President Uhuru and President Barack Obama. The agreements were therefore approved by the Cabinet then in April of 2016 and subsequently introduced in this House in Parliament, laid on the table of the House on the 19th of July 2016. Upon undergoing parliamentary procedures and public participation and the House process, the House approved the ratification of the agreement on the 9th of February 2017. This agreement subsequently entered into force on 6th of April 2017 and has a validity of 5 years. And Honorable Speaker, the renewing of this cooperation was again signed and came into force on the 5th of April 2022, which the annex I have provided. The extended agreement has a validity period of 7 years and is valid to the 5th of April 2029. Further, on the 4th of December 2025, we again signed a cooperation agreement with the United States of government to strengthen Kenyan healthcare system on our different areas, including digital health, including HIV/AIDS, TB, and malaria. Over the last 23 years, Honorable Speaker, the government and the people of the United States, through the U.S. government health program, has provided close to $8 billion, equivalent to slightly over 1 trillion Kenya shillings in support of the Kenyan health sector. This investment has significantly strengthened our national response to HIV, TB, malaria, maternal newborn, and global health security. The government of Kenya deeply appreciates this long-standing partnership and remains committed to ensuring that the gains made are sustained through the increased domestic investment, strengthened institutions, and successful implementation of the Kenya-US Health Cooperation Framework, which provides a pathway towards greater country ownership and sustainability of our health program. Honorable Speaker, the proposed Ebola treatment and isolation unit at Laikipia Air Base is part of the 23 similar units to be established in the country as part of our preparedness and response. This facility will jointly be run by the government of Kenya and the US government under the command of the Air Force Commander, the base commander, and the entire medical team of the Kenya Defense Forces, working together with the Ministry of Health. This proposed facility reaffirms Kenya's position as a medical hub in the East Africa region with the capacity to offer specialized care for complex infectious diseases like Ebola. I must also inform the House that aspects of the matter relating to the alleged international health agreements and containment arrangements are now before court. Accordingly, and in keeping with the doctrine of sub judice and standing orders of this House, I will avoid discussing the merits of any active litigation. But I will, however, continue to provide this House with the government's public health position and preparedness status. Honorable Speaker, you also asked about the establishment and accessibility of the Ebola disease control and isolation centers. Honorable Speaker, the House asked whether Ebola disease control and isolation centers have been established in the country. And I want to say this. I hasten to add that there is a significant presence of Kenyans in the affected regions of both DRC and Uganda. Many Kenyans work in Uganda and do business both in Uganda and DRC. And two of our leading banks, KCB and Equity, employ Kenyans who live in that region. In addition, Kenya has approximately 450 specialized KDF officers and servicemen who are in DRC under the MONUSCO peacekeeping mission. Any of these Kenyans could be exposed and could require a quarantine and isolation facility back home in Kenya. The government has established undesignated isolation and treatment capacity as part of our national preparedness. These include, I said, our national referral facilities, our county designated sites, temporary holding areas for points of entry, county isolation facilities. These facilities are being progressively verified for quality, for safety, and for readiness. And I want to reiterate that all such facilities are established for the protection of the people of Kenya and all persons within the Kenyan borders. They are not only foreign facilities, they are not for foreign facilities, they are not exclusive facilities, they are not facilities reserved for any nationality, they are public health assets established and coordinated under the authority of the government of Kenya. In the event of a suspected case, the response will be guided by medical triage, exposure risk, clinical need, and public health protocols. A Kenyan citizen, a foreign national, a refugee, a diplomat, an expatriate, or a traveler will be managed according to the same public health principles: safe isolation, testing, clinical care, contact tracing, prevention of further transmission. Our objective as government is to protect communities, to protect healthcare workers and the country. When a case is detected, the safest place to manage it is within a properly equipped isolation and treatment facility under the controlled conditions. Finally, Honorable Speaker, you have told me to give guidance on the public health guidance. Honorable Speaker, any person who develops fever, headache, vomiting, diarrhea after recent travel to the affected areas or one of their community members after contact with a suspected case should seek medical attention immediately and report through the 719 public health hotline. Honorable Speaker, our readiness assessment gaps and resource requirements are all provided in this document, and I think I have provided the agreements, the documents, but just to conclude so that I take questions from members, Honorable Speaker and members, it's very important, you play a very important role in the public health protection of our country. Misinformation during disease outbreaks can cause panic, can cause stigma, can delay health seeking and resistance to public health measures. I therefore request members of this House to support the Ministry of Health by amplifying accurate information, encouraging early health seeking behavior, supporting screening at border points of entry, and urging the public to use the official 719 hotline. Honorable Speaker, I want to repeat for emphasis, Kenya has no confirmed case of Ebola virus disease. Our surveillance systems are active. Our laboratories are functional. Our points of entry are screening travelers. Our rapid response teams are on standby. Our health workers are being trained. Our isolation facilities are being verified and strengthened. And the government of Kenya remains fully in control of the preparedness and the response architecture. Our approach is guided by science, the law, the national interest, the public health protection, and the international obligation that as a country we have. We will continue to act transparently. We'll continue to act decisively. We will continue to respond responsibly in order to protect Kenyans and all persons within our borders. I thank you, Honorable Speaker, and I'm ready to respond to any questions from the honorable members.